Hello, I'm Dr. Jessica McCain, founding physician at Southern Comfort Health Direct Primary Care. We have created a series of videos for you called The House Rules, but this is not for me to wag my finger. It's more for you to understand how our services work, so that way we can maintain our workflow efficiency and you can get the most value out of your membership. We will be going over things like office hours, how to contact us, the use of our pharmacy, lab services, and imaging, as well as how we communicate with other specialists in our hospital roles. If you have any questions, please reach out. Otherwise, we hope you have a fantastic day and you enjoy your membership. The clinic is open Monday through Friday for care coordination. We cannot accommodate walk-ins, so if you are sick or you have an urgent care concern, you would contact our office so we can triage your needs and then schedule for a same-day or next-day appointment as appropriate. Appointments are booked for 30 minutes, but if you feel like you need more time, you would just let us know at the time of scheduling. Appointment reminders go out 2 weeks as well as 2 days in advance to your text or email, so please let us know as soon as possible if you need to reschedule so we can keep those spots available for other members. If I am going to be taking time off, all members will be alerted well in advance by email. If it is after 5 p.m. or on the weekends, like you, we are with our families. Please don't contact any staff except for Dr. McCain and myself if you have a medical concern. Of course, if your concern is significant, please don't delay care and go to an emergency room or urgent care facility. If I can help, please text me and I will try to do my best, but no, we are not an urgent care facility either. You will be given our contact information at the first appointment, and this includes our cell phone numbers and email addresses for both physician and staff. It's important that you program this information correctly because we don't want to miss any of those communications. Text messages are more appropriate for those very brief interactions, like a same-day need alert. If it's going to be a back and forth conversation, we prefer you just to schedule an appointment, even if it's only going to be for a 5 or 10-minute conversation. Be mindful too, those text message alerts do sometimes interrupt our appointments, so try to condense your messages to 1 or 2 if possible. Voicemails are checked a few times a day, and emails are definitely for those non-urgent care needs, as response time can be up to 72 hours. Knowing who to contact is important as well. You can contact my staff if you're scheduling an appointment, checking status on referrals or other paperwork, refill requests, but if you have a question that's specific to your medical health, just ask me directly. We do send out a lot of emails, so if you haven't seen anything from us in a month, make sure you're checking your spam box. For example, at least once a month, you'll be getting an invoice, but also you will see newsletters, copies of your lab reports or imaging reports, offices, notes, so please be sure to check that email. The fact that we can dispense medications at our pharmacy is a huge value to our members for both cost and convenience. Regarding cost, you are welcome to use your insurance and send prescriptions to the pharmacy if that is your preference. But a lot of our patients with insurance see the cost savings of getting them through us by paying cash. We compare to GoodRx, so we know that our wholesale discounts are passed along to patients. And not just for pharmaceuticals, we also carry a lot of over-the-counter medications, so even those things like vitamins and cough and cold medications, we keep in stock here at the pharmacy. And you can pick up your medications during office hours, but if you're unable to and it's late at night, ask us to put a locker set up for you on the front porch with a code that's designated for you. Of course, we ask that you please pick your medications up within 24 hours, so we have lockers available for the next patient. We do have a couple house rules when it comes to asking for refill requests. First, please don't ask for any last-minute refills. Be responsible and ask for a refill 3 days in advance to allow our small team to have the appropriate time to do any refills or purchase inventory. We are mindful about costs, so we don't tend to over-purchase medications and have a large stock because every month we're throwing out expired medications. Also, to help with our efficiencies, try to consolidate your refill requests. Rather than one every couple of days, let's get your pills organized so that way you're requesting medications 1 or 2 times a month. And if it's a medication you've been taking for a long time, let's get that filled for several months. Again, it's about convenience. Please note that it is our office policy not to prescribe controlled medicines. I certainly don't prescribe for long-term pain management. Otherwise, exceptions will be made in individual cases with drug testing. Another really great service we offer is discounted labs. We have pre-negotiated rates through our DPC networks that are even better than what typical cash rates are for patients. So much so that a lot of our patients with insurance prefer to use our cash rates. Now, what is important is that if someone is using their insurance, they know their benefits because we cannot reverse charges if we find out the cost is more after using insurance. And we've seen bills more than $1,000 for what would have only been $50 of lab work through us. In general, we prefer our patients to get their labs drawn at outside facilities, and there are a number through our county. Our medical assistant is trained in phlebotomy and does a fantastic job with lab work, but we need to be mindful about our resources, the supplies that are provided by the labs, and designate and reserve those supplies for patients who are sick or otherwise have challenges getting to the laboratories. Often, you will get results in your email before our appointment. And it's okay if you want to Dr. Google and read about what your issues are, but know that if there was anything serious or that there was an urgent action item needed, I wouldn't have sent that in an email. We'll fully discuss all those lab values at our appointment. And sometimes we can do that over telemedicine, but other times it's preferable to be in office. We want to let our DPC members know that we are going to continue to add value to the membership at Southern Comfort. For example, we've been able to gather more supplies that help with diagnostics and procedures, like the EKG machine that we can loan out, a glucometer. We also have Southern Comfort Wellness, which is our retail line, selling integrative products such as CBD, herbal vitamins. If you've been referred for imaging or specialty services, you are contracting directly with those facilities and need to be aware of the costs. Now, what we've done is create a database of hopefully the best rates, and we will refer you to those facilities. Did you know that if you have insurance, you can declare the high-tech right, which is an addendum to the HIPAA laws that states you do not want to have your records transmitted to the insurance company and you agree to pay for cash rates up front before services are performed. We have found that some patients discover the cost for paying cash is cheaper than what would have been through copays with insurance. Not every facility is aware of the high tech, but we will do our best to educate our community partners. I think what's really important to realize is that in the DPC model, we are able to work very closely with our patients. With extended visits and the ability to follow up in a couple of days, doing trials of care and testing different things, we can oftentimes come to solutions without the need for specialty services. In primary care, I should be handling 80% of your medical needs. Help us get the medical records from any other previous place you've been, emergency rooms, urgent cares, imaging facilities, that colonoscopy you had. I want all those records. Please let us know if for whatever reason you're having challenges with specialty care clinics, and we can help coordinate a little further. One misconception is that my clinic is for the uninsured, and that's actually just not true. The majority of our patients actually carry insurance. But I can handle 80% of your medical needs, and you should have some sort of coverage for the remaining 20%. Those hospital visits, the unexpected, the specialty care needs. These can be financially burdensome, and that's the whole point of having an insurance. Now, if commercial insurance is not a possibility due to cost, there are other options out there, like a health share, catastrophic plan, wraparound plan. These are often much cheaper than typical deductibles from commercial insurances. And so they complement very nicely with the DPC model. Insurance plans that are HMO require a gatekeeper. So for my patients who have insurance HMOs, if they need to see specialty care, they still need to see their assigned primary doctor to then put another referral in. So if this is an acceptable barrier, then that's okay. But more so, I'm finding patients with HMOs not wanting to see that other established physician, and that's a problem when specialty care is necessary. Our membership pricing is based on age. We require an active form of payment to be on file. Invoices are sent out around the first of each month, notifying what to be expected on that withdrawal date. We prefer ACH bank draft over credit or debit billing to control cost of transaction fees. We only do 12 transactions a year, so if you make an incidental purchase, meaning laboratory work or pharmaceutical prescription medicines, these would be charged to your next month's invoice. If you have any questions about how to interpret your invoice or the charges, please contact me directly.